Hello, and welcome back to the Self-Service Podcast. Today, I have a very special guest on the show, and we are here to bust some myths around mental health issues, and mental illnesses in order to help break down some of that stigma and hopefully enlighten you guys on how to understand these areas a bit better. So firstly, welcome Maggi Rose. I've had the pleasure of working with Maggi for the last 2 years now. Maggi, you've dedicated your whole life to mental health, both clinically and in a workplace context. Could you tell us more about you and your background?
Okay, well, I've been thinking about where my passion first started for mental health. And of course, it was never there because mental health found me rather than me looking to do something in this arena. And started many, many, many years ago when in my daytime job, I did a voluntary visiting to a hospital for the chronic sick. And one of the people that I visited got moved to our local mental hospital, which was a big old institution. And she was moved there, and I knew that I was her only visitor. So even though I was scared, and even though I'd grown up as this place being the loony bin and the place where all mad people, and I knew nothing about it, but I knew everything about her and knew that I wanted to visit her. And that's when the love affair began. And so I plucked up the courage, went to visit her she was in a long stay ward. And then that was where I fell in love with the whole topic of our mental health and the experiences of mental illness.
Thank you for sharing that. And I think it has a scary connotation, doesn't it? As you mentioned, the thought of, a big mental health institution, a mental health hospital. And I think lots of people think about that when they even hear the term mental health, which is why I really wanted to talk to you today. But could you talk us a bit about where you next went in terms of your career? Because you spent a long time working in the NHS, is that right?
I did. So in total, I trained then for the next 10 years, really. And I indented my training with, of course, clinical experiences in the wards. And I was specializing in acute mental illness at that time. And I also had a real kind of penchant for forensic mental health too. So I spent really the next 10 years in and out of a whole variety of training and development and clinical practice. And this took me through the roles that I've had in my career to date. And I ended as the Vice Principal of Mental Health at City University, where I was rather hoping that after all these years, I could make a bigger influence on the training and education of those that choose to be working with people with mental illness. Because even though I've worked academically myself, I believe that working with people with mental illness is as much an art as it is a science. It's not enough to know about it. It's about how you interact with it and how you build relationships with people who are experiencing mental illness. Did I succeed at that? Well, not really. There was a very strict structure in place about curricula and about how we trained people to be working in the service of mental health. So eventually, I found myself, after taking some time off to care for my own mum and dad and starting my own business, I then found myself working for the Mind, the mental health charity, and it was at the time of Time to Change, and where we were really truly beginning to talk more openly about the changes that need to happen, about people's understanding and the stigma around mental health. And that's where my workplace passion began. Seeing as we spend most of our lives at work, I think it's a very good place to start the understanding of what mental health and mental illness is and how much work impacts on it.
Yes, and I think what you've just said there, it's evolved a lot in terms of how we do understand it, what people what language people use, and I suppose the fact that it's even talked about more so today more than ever, it's come a long way.
Yeah.
But there's still so much stigma that exists. And do you still see that crucially in the workplace?
Most definitely. I mean, I keep telling myself, and we have moved a long way, and let's not lose sight of that. We've moved a long way with our understanding, with our practice. We've moved a long way with legislation and the support that we have around the law. And we've also more recently got support around the World Health Organization recommendations, certainly in terms of the workplace. So I think the appetite has definitely moved. However, your next part of the question was, am I seeing a real movement in the original stigmas? Not always is my answer. There is still so much misunderstanding, fear, and reluctance and ignorance around this group of illnesses.
Yeah, and I totally agree. And that's why I'm so grateful to have you on the podcast today, because I feel like there's still so much space for us to continue the conversation and, bust those myths that a lot of people commonly have, whether that's unconsciously or consciously. We have
Absolutely.
these biases and opinions around it. So, first of all, for everyone, I think it would be helpful to understand, what is mental health in your words?
Okay, so first of all, also for everyone, whatever I'm saying to you today is representing myself, my views, my experience, and my lifetime working in mental health, not necessarily taking an academic or media opinion of it. So for me, mental health is being able to make healthy choices in terms of our emotional, our psychological, and our social world. So it's about thinking, acting, and feeling in a healthy way. And even as I say it, I'm thinking, healthy according to who? Which is another big question. But as a summary of the definition, I think that summarizes it well.
Yeah, I can imagine that's quite subjective in terms of how you feel compared to what your normal what you feel your normal state is, perhaps.
Yes, and you will know this, Alex, because
Yeah.
one of the words I despise more than anything that's attached to mental health is normal,
Yeah.
because we fall into it every time. So, your listeners, I'd like your listeners to just reflect for a minute and say, so what is normal? Is
Yeah.
it normal for me, or is it normal? Who is judging the normal? So, it's one of those words that I think has been tied with mental health and mental illness, and should be untied. It's
Yeah,
not about being normal or not.
I agree, and that's exactly why I use that word to prompt that. Thank you. And what are mental health issues and mental illness then, for example, and what's the difference between those two? Because we often talk in our work about the mental health continuum and how we move and our mental health fluctuates to and fro, but how can we distinguish the difference between these two terms?
Well, I think as well, going back years, there were two states of being, which was mental health or mental illness. And we didn't really understand this midway that has been quite a contemporary development of recognizing that people aren't in a healthy state and they aren't in a full illness state. But in fact, they're experiencing something that is having an impact or a consequence on the way that they're living their life at the moment. So it's not a healthy state, it's not an illness state, but it's an impact state where you are experiencing something either emotionally, psychologically, or socially that is interfering with what you could, should, and would do otherwise. So that's where issues came from. And I think I couldn't miss saying to you that this word issues is another one, because often people say, well, mental health problems. Often they say mental health disorders. The reason I love the word issues is because it's infinitely time framed. So it's an issue that can be worked on. The other thing is it's not a condition or a disorder. These are quite pejorative words that really enable stigma further. So I think that issues is a very kind and descriptive word of the way that we feel when we leave our full mental health status. So that's why I like issues. And of course, illness is where you have been diagnosed and treated for something that is having a major consequence or impact on your life and the way that you wish to live it.
Okay. And could you give us some examples of perhaps what may fall into a mental health issue category versus a mental illness?
Yes, I mean, the kind of issues, and I think that we will all experience these. We will all experience mental health and mental health issues. And that's where we're not at our best. Life isn't dealing us a fair hand at the moment. Something has come into your life that you didn't invite or welcome to change your perceptions of joy or peace or happiness or productivity. So I think that the very typical ones that we talk about, it may be anxiety, and anxiety falls into the category of both an issue and an illness, depending on how pervasive it is and the consequence of your experience. I think we can all identify with anxiety and say this is a state where we have this feeling of fear and doom and worry, and we're just feeling anxious, which is very, very different to having a generalized anxiety that is there all of the time, from waking until sleeping. So the issue of anxiety would be very typical if you are looking at maybe work changes, redundancies coming up, change of mergers and acquisitions, whether or not you're getting older within your workplace and you're concerned about that, whether you feel inexperienced to continue work, lots of different things, relationship issues, waiting for health results. All these things can enable anxiety to be an unwanted visitor in our mental health. The difference is, with the passage of time and the support and help, issues will pass. Illnesses will usually be longer lasting.
And that begs the question, what illnesses can be treated or managed, or is this something we have to move with and navigate for the rest of our lives? How would you explain that?
Well, there are a group of illnesses that I prefer to say are severe and enduring. Mm-hmm. So you will probably carry them or elements of them for very long periods of time, if not a lifetime. These are considered to be SMI, serious mental illnesses. And years ago, there was only one call, there was only one route that you could go, and that was the treatment route. Mm-hmm. So we're talking about here bipolar disorder, for example, which is quite severe and enduring in terms of its changing a movement of moods and your behaviors within those moods. We're talking about schizophrenia, that we still know so little about why people experience schizophrenia, but you are very unlikely to recover from bipolar disorder, from schizophrenia. There'll be some clinicians that will classify personality disorders, in particular borderline personality disorder, in this way. There are also some of the dementias that are still considered within this category of a severe and enduring mental illness, even though it has a physical causality to it. So yes, years ago there was really only treatment, and I think what we're learning now is the role of management and self-understanding alongside treatment. I'm also talking about, because I've been around long enough to tell you this, that of course years ago, 40 years ago, when I came into mental health, then you wouldn't stand a hope's chance of getting yourself in employment, or even on a property ladder, or having a driving license, or any of these things, if you experienced a serious mental illness and the treatment of it. Because the treatment of it was extremely serious and also created its own set of problems for you. So the treatment of the illness created a different set of problems, both physically and mentally, for you. Now we're looking at early intervention of psychosis, and we're looking at understanding hearing voices. We're looking at understanding it so that you can self-manage. We are looking at many people with early diagnosed first episode psychosis that we would have called schizophrenia years ago. We're looking at these people actually not taking medication and managing their mental illness through understanding. There is one thing to say: managing it alone when you have a serious mental illness is a very tough call. So when I'm talking about management here, I'm talking about medication if and when required, but I'm talking about ongoing, authentic support from somebody who truly understands the illness and how it's going to impact.
Yeah, this has made me think about a personal, I suppose, experience of my dad. From a young age, he was in and out of mental health hospitals, where he experienced psychosis when I was younger, and he also had severe depression, of which the depression he has, he still lives with now, but he's on medication which keeps him at a sort of functional, stable level. Yeah. So it's interesting to hear you say that perhaps nowadays, would that have been potentially, if this was now rather than 25 years ago, may that be looked at a bit differently? Because I think there is a tendency, or what I hear, that people should go straight onto medication without looking at the holistic view. And I suppose my question is around what I'm hearing is this, about prevention? And what's the place for that?
Oh, absolutely, yes. And I think that now we've even got the guidelines now, the clinical guidelines, to not treat somebody until you've fully observed everything, because then we get a masked impression of what's going on for people. Often that leads to inaccurate diagnosis, or it did in the past, and therefore the treatment followed that inaccurate diagnosis in the first place. And the question that you're asking is one I often ask myself that, and I ask the same about post-traumatic disorders, because I wonder, when I look back at the hospital that I worked in, so many of the long-term patients in there were post-war veterans.
Mm.
And, you know, you can't help but wonder, they were automatically treated for schizophrenia, assuming that their voices and their replays of things were hallucinations. And of course, as we grew to know much more about the signs and symptoms of post-trauma, then we know that that is characterized by replays and by hearing things and seeing things all over again. So I can't answer the question about your dad, but I can say I ask that question many, many times. And I guess it's so, as we move on with any illnesses, Alex, that, you know, you used to die from measles, and
yeah,
so all of our illnesses, including mental illnesses, and of course we're way behind with our understanding of mental illness, but I think the developments always make us look back to say, was the past an accurate reflection of what really happened?
absolutely. And what about depression specifically? Because I think also a lot of us say, oh, I'm feeling low. Oh, that's depressing me. Oh, I'm feeling depressed about that, versus actually living with depression.
Yeah.
What can you tell us about the differences between that and more from clinically to perhaps how you might be feeling? And as we said earlier, about fluctuating in how you do feel, and what that difference is.
Well, I think that your listeners will hear that the major theme here is about the length of time that something is impacting on you. And so, a bit like anxiety, we can all get anxious. You know, maybe you're afraid of heights, and you create an anxiety that will pass. But I think that once you've got something that is long lasting and pervasive in this way, then you're talking about the difference between, first of all, a word, because our language likes to use words like anxious, depressed, stress. You know, we like to use those words thinking that other people know what we mean. And as a result of that, we've become a bit tired of the words, which I think contributes to the stigma a bit.
Mm-hmm.
So when everyone's saying that they're depressed, then, you know, depression seems to have a different worth then. When I talk about depression, it's far greater than a low mood that is going to last for days or weeks, that this is something that impacts on your daily life, your sadness, your unhappiness, your inability to even understand it, to move beyond it, to manage it in any way. That's when depression is illness. And so you lose sight and you lose the essence of any feelings that are positive or joyous. And that goes on for a long time. Now, you might be saying, well, how long is a long time? Well, you determine that, you know, and so do your family, and so do your loved ones, because we can all understand feelings of depression that are as a result of a reaction to something sad or desperate or traumatic. But somehow we all have a time limit in our mind about how long that's supposed to last. And so I think that that's a matter of your personal and your nearest and dearest, the whole definition of what is too long. For me, when it starts to impact what you could, should, and want to do, then it's too long.
Yeah. And when you say that, you know, how long can that be? I automatically do think of my dad, because that started when I was, gosh, between the ages of 5 and 7, and I'm 30 now, and it's something that he still lives with. So I completely understand how debilitating and life-changing that can be because of what I've seen, you know, and sort of characteristics that you've mentioned. You know, my dad doesn't drive anymore. He lives a very simple life on his own. He doesn't really sort of socialize, and you know, that's very different to how he used to be, but that's been over a significant number of years. So I really resonate with that. And you also mentioned about friends and family, and I can't help but think how important that is to have that community around you. So a question I suppose I wanted to ask is, what could we do if we do notice people changing, you know, from perhaps what we see as good, positive mental health, and we see changes in our loved ones? What can we do?
The first thing that we can do is love somebody anyway. So I think that it's very hard to like the behaviors that mental health issues and mental illnesses invite you to display. So I think that there's something about examining the relationship you have in the first place, because only those nearest and dearest and trusted are the ones that really have the certificate to talk to me. Okay. So when somebody notices and they don't know me, then that kind of it is irrelevant to me. Mm-hmm. But my nearest and dearest saying to me, Maggie, I'm worried about you, and not trying to put the feelings that you're seeing, but saying what you are seeing. You know, you don't seem to text me anymore, or you don't answer in the way you did, or you're looking sad. So you know the permissions that you have got within the relationship and the language that you normally use. And so my big advice is to just use that, just say what you would normally say, and say what, you know, what your heart is telling you. There are no right words to say when somebody is really experiencing depression. And there's no wrong way to say it. There's no wrong words to say. But to say, I've noticed and I really care about it. And when you're ready, so am I. And to just really make sure that you are present and not turning your back. With severe and enduring illnesses, I think one of the hardest things to do is maintain your own energy and your own friendship when somebody you love dearly is experiencing a longer term mental illness. It's quite exhausting. It's quite unfulfilling at times. It's very frightening in case you say or do the wrong thing. You may hear things that you don't know what to do with. And so I think that it takes a good, loyal qualification to be, you know, saying anything to those that you've noticed a change in. Yeah. And if in doubt, ask. Yeah. You know, one of the great myths around is that if I'm experiencing a mental health issue or a mental illness, that you can't have a normal conversation with me. Well, of course you can. Mm-hmm. You can say, Maggie, I don't know what's going on for you, but, you know, I'm feeling sad. And just ask me. So just be yourself and know that you care, and make sure that person knows that you care. And one thing to always remember, it's not them, it's their illness. And I think that that's a really important mantra, that however they're answering, treating you, mistreating you, this isn't them, it's their illness. And so forgive a little more. I'm not saying get abused, but be forgiving and know that this is the illness talking.
Maggie, I really love that. And I think that's the biggest obstacle that we experience in this world when it comes to this topic, because people are scared. And they're scared of saying the wrong thing or doing the wrong thing, and perhaps, you know, find it uneasy to be around people when they're experiencing, you know, illness. But with that often leads to avoidance, and
Yeah.
that's the awful part. You know, I've seen in our family, you know, family that just isn't part of our lives anymore because, you know, they obviously found it quite difficult to have those conversations and be part of that, because it was like, well, I don't know what to do, so I'm going to do nothing. So I think what's
Yeah.
really important is that we don't fall into that, because as you say, it can be so easy as asking a question and letting that person know that you're there. So what can we do to be more aware and help remove the stigma that surrounds mental health?
Well, today is a step. It's a positive step because for me, still the biggest hurdles to climb with stigma is true understanding of what things are and what they're not.
Mm-hmm.
And so to really try and improve your own knowledge around mental illness, particularly if someone near or dear to you is experiencing it, then get learning about it, get understanding everything that you can tolerate about it, so that you can really feel a lot more confident about pushing away some of the myths that you may have grown up with and not realize that they're buried in your unconscious bias. So learn an awful lot. Be courageous. Know that there is no wrong thing when you care about somebody. Know that asking somebody, how are you, means you should stick around to listen to the answer. Otherwise, don't ask it. Know that how are you sometimes takes two asks. How are you? I'm fine. How are you? Well, so, stick with it. And I guess the other thing is practicing skills. If I were to leave your listeners with something that I experience most when people are talking about, well, how do I ask or how do I behave? You can't solve this. Don't start giving solutions to somebody that has probably tried every single thing that you can possibly think that might come out of your mouth. Of course they have. Please don't give banal solutions when somebody has opened up and expressed their own mental health issue to you. They want someone to listen. They know you can't solve it. Telling someone to go out and have a walk or go down the gym is absolutely not okay when I can't even get out of my bed. So please, please look at your questioning, how you're talking to people, and try and stop yourself giving solutions, because my mental health is mine. It's not yours. And you have no solution to give me that I probably haven't thought of myself.
Wow, thank you, Maggie. That is one that I imagine we all can relate to. I'm pretty sure we've all been on the receiving end of someone giving you solutions when you are feeling so bad or feeling like you just need someone to listen. And when you kind of pluck up that courage to actually finally talk and open up, and then you're met with all of these solutions, it makes you feel so much worse.
Oh,
And
it really, you feel so angry, actually.
yeah.
And there's something else that you're making me think that I want to leave people with as well. Don't do comparisons either.
Oh,
Just, oh, I know how you feel. I felt like that last. Comparisons are wicked.
yeah. And I think it's that misconception that we feel like we need to solve this for someone. And yeah, well, I've experienced this, so this will work for you. And no, we're all individual. We're all made up of our own experiences. And my mental health is mine, and your mental health is yours. And I can't advise or give you expertise on that, because you're an expertise in your own mental health. But I'm sure we've also been on the other end where we can remember times where we have also been like that and given people solutions. So
Yeah.
I think that's such a key takeaway for us all to think about as we sort of go on our day-to-day lives with these occasions that do come up frequently. But thank you so much, Maggie, for coming on the episode. I think to summarize some of the key points that we've gone through, I think the key messages are mental health is something that we all have. We
Yep.
all have it. And it moves frequently to and fro towards issue, to back to health, depending on what's going on in our lives. And it's okay for that to happen. And language is key to this. Key to removing stigma is, keeping yourself up to date with the knowledge of what issues and illnesses are and what language to use, because a lot has changed in the last few
Yes.
years. And asking questions and perhaps signposting it is a key message there of if you do notice changes in other people, but also in yourself. Make sure that if you're not feeling okay, that is okay, and do talk and seek help. And I think that with this messaging in mind, we can all play our part and play a responsibility in helping remove that stigma.
Yep, totally. And let's all do it, in one small way or another. Let's bust a stigma today.
Absolutely. Thank you so much, Maggie, for taking the time and coming on the episode. It's been so good to have you, your knowledge. You're so engaging. Where can people find you if they are interested in your work or interested in chatting more?
My name is Maggi Rose. As you know, you can find me working away at Mental Health at Work. And so I encourage you that if you're looking for a workplace piece, then Mental Health at Work is a very good resource for that. And other than that, you can just Google me at Maggi Rose, and I have no E on my name, so it's Maggi. So I look forward to inviting anybody to further this conversation. And I thank you, Alex, for running this series, which is an important part of busting stigma. So good luck with future podcasts, and I look forward to coming back again one day.
Thank you so much. I'll certainly have you back. So thanks everyone for listening. Please jump on and give this episode a review. Make sure you rate the podcast on whatever platform you're listening and share on your socials. So the Instagram is at @theselfservice_, and tune in next time to discover the power of self-service.